Let's talk about vitamin E. Vitamin E is one of the most powerful biological antioxidants, but the average person is deficient in vitamin E. This is why supplementing is a must for most people. However, as with many nutrients, supplementing can be a big problem because there's very little real vitamin E on the market. Vitamin E protects against all kinds of degenerative diseases, including cancer and heart disease and Alzheimer's and cataracts and aging. Vitamin E is one of the best treatments for heart disease. It helps to prevent and it speeds the recovery of heart attacks. It helps to prevent fibroids and endometriosis. Vitamin E speeds wound healing, including healing skin ulcers. It strengthens and regulates the heartbeat. It's effective in treating varicose veins and severe body burns. One of the most important functions of vitamin E is to prevent free radical lipid peroxidation. And what this means is oxidizing the fats in your body. Once oxidation begins, this starts a chain reaction, and this damages cells and tissue, and it creates disease, and it speeds the aging process. Vitamin E is oil soluble, and this is important because it helps to protect the fats in our body from oxidative damage. It's also an excellent antithrombin, and this means it prevents blood clots from forming. In short, vitamin E lowers the risk of coronary heart disease. Now, when experimental animals are deprived of vitamin E, guess what? They die of heart disease. So that's what happens. Vitamin E also helps to prevent cancer. The incidence of prostate cancer, for example, is cut by more than 40% among men who supplement with vitamin E. In addition, there's a 75% reduction in cataracts with those who have been supplementing with vitamin E for 5 years or more. And that's one of the biggest items in the Medicare budget, by the way, cataract surgery. More than 75% protection from taking vitamin E for 5 years. Now, in people with diabetic retinopathy, which can cause blindness, 4 months of supplementation with vitamin E restored normal blood flow to the eye. Vitamin E slows the progression of Alzheimer's disease by 50%. Vitamin E applied directly to the skin slows the aging process and produces skin that looks younger and helps to heal ulcers and wounds and burns. Most Americans only get 12 to 15 IUs of vitamin E per day. The RDA is 22 IUs. Now, the RDA is always low. The average American is getting less than the RDA. Advanced physicians, people who are doing advanced medicine, use vitamin E routinely in their practice, and they usually recommend 400 IUs per day for each 40 pounds of body weight. So if you're 120 pounds, then you should be taking 400 IU capsules per day. And for those with acute health problems, about 2,400 IUs per day is usually recommended until you can go back to a regular maintenance dose. Unfortunately, most of the vitamin E on the market is synthetic, and it does not metabolize well in the body. Natural vitamin E is what you need, a natural product that contains all the different forms of vitamin E that work together in the body to give you the protection that you need. Beyond Health's vitamin E is acknowledged as being the highest quality vitamin E on the market.